My name's Dr. Russell Barber. I trained at Harley Academy back in 2019, 2020. I did the level 7 in injectable medicine. Medically, I am a doctor in intensive care and I'm a doctor in anaesthetics, and I still work in the NHS. I'm a consultant in both of those. That's my kind of day job. But I also work in Southwell with Marcus at Story Clinic there. Through my training, I've always my training in anaesthetics and my training in medical school and training in intensive care, I've always strived to be the best and strive for a high standard of care for my patients. And that's the same happens in my aesthetic practice. I want to provide the best for my clients. So the level 7 by Harley is the standard. I think it's the gold standard to provide a high level of care for clients. It was a challenge, but it was a challenge where the hurdles were made so much easier by Harley Academy. The provision of the opportunities to attend, the kind of the family atmosphere to provide and be responsive to your learning. So I like to think myself as a kind of self-guided learner, as I have had to be, but there's always that kind of family network to provide your needs in your training. So I thought it was excellent from that point of view. Well, I know my not so favourite part, that was the exams, but I'm used to having to pass exams, and that's part of the process. But no, the favourite part I'm very, through my job in anaesthetics and ICU, I'm very needle centric. So it's using those practical skills and those translational skills that I enjoy. I enjoy my other jobs and also as an aesthetic practitioner. So I enjoy doing that. That's kind of the main purpose. Yeah, it's putting what you've learned and all your theory into practice, and then therefore the actual injecting. Because a lot of it was online, the resources are there. You can dip in and dip out, and you can do your training around your lifestyle, and you can use it to complement what you're doing in your day job as well. I think when I first started to inject, I was probably overconfident because of my background, and actually I think the most important for me was that Harley was able to kind of to rein in that enthusiasm and that maybe overconfidence, and actually bring me back to the basics and build me up again in the style and what's needed for aesthetics practice to deliver things safely and appropriately. What's really nice about Harley Academy, I can still access all their training resources, even the ones that have been updated. And that's quite useful just to dip in and dip out as a resource, because there's things you do forget as you keep on practicing. There's things you forget about, some of the anatomy, and you can just kind of bring yourself back to the knowledge base of anatomy and things to make sure you're doing it right, particularly if you're injecting more by yourself. I think someone who's working in the NHS as a doctor, there's a lot of skills they can gain from their practice there, and then gain those experiences and utilise them when you're in the aesthetics industry. So you don't want to become a doctor and then immediately move into aesthetics. There's a lot of learning to be done in the NHS or in medical practice that you really need to build up and utilise those in your aesthetic practice for the benefit of clients. So some of those names, it's not just the injecting skills, it's the interpersonal skills, working as a team, using the kind of audit standards and clinical governance, as well as learning about how a lot of diseases affect the skin, and how that is important for picking up for your clients, and then adjusting your treatment plan for them based on that. With a slightly biased opinion, but having been in the industry for a number of years, I still think Harley Academy is the gold standard in terms of provision of education and teaching, and the development of you as a practitioner even after you've done your level 7?